Welcome to Sato Career 2.0 online nursing channel. In today's video, we are going to discuss previous questions of Railway Recruitment Board Staff Nurse exam. This is part 1 video which contains 50 questions. Before going to today's video, please subscribe to our channel. If you have not yet subscribed, please click the bell icon to get latest notification about our new videos. Let's see the first question of the day. 20 cc is equal to how many ml? A 2 ml, B 20 ml, C 2000 ml, D 20,000 ml. There is some confusion about metric words like milliliter and cubic centimeter. These are just different names for the same amount of volume. Hence, 1 ml is equal to 1 cubic centimeter. So, by this explanation, you all may got the answer. 20 cc is equal to 20 ml. Now, question number 2. Contraceptive failure is calculated by A. Russell index, B. Pincus index, C. Pearl index, D. Wright's index. Contraceptive failure is best calculated by Pearl index. It is named after the American scientist Raymond Pearl. Is the measure of the safety of contraceptives. The smaller the Pearl index, the safer the method of contraceptive. About Russell index, it is used in the stock market. Similarly, Pincus index is also used to determine the growth and investment, whereas Wright index is a pathological measurement of mucous gland proliferation in a chronic bronchitis. So the right answer is option C, Pearl index. Question number 3. Extrajugular vein drain into which of the following vein? External jugular vein drains into which of the following vein? A. Facial vein, B. Brachiocephalic vein, C. Subclavian vein, D. Internal jugular vein. The right answer, subclavian vein. Question number 4. All of the following included in the electromagnetic spectrum except A. Visible light, B. Gamma rays, C. Beta rays, D. X-rays. Electromagnetic waves include 7 types: radio waves, microwaves, infrared, visible light, ultraviolet, X-rays, and gamma rays. So beta rays is not included in the electromagnetic spectrum. Next question. A thin fibrous ring present at the margin of the chorionic plate is A. Placenta marginata, B. Placenta circumvallate, C. Placenta substantiata, D. Velamentous insertion. So by the question you get the answer. The thin fibrous ring present at the margin of the chorionic plate, that is placenta marginata. Placenta circumvallata, it is a morphological abnormality, a subtype of placenta extracoralius in which the fetal membrane double layer on the fetal side around the edge of the placenta. Placenta substantiata, it is an extra placenta separate from the main placenta, and it is also called accessory placenta. Velamentous insertion, it is a complication of pregnancy in which the umbilical cord is abnormally inserted into the placenta. So the right answer from the question we take option A, placenta marginata. Question number 6. Puberty menorrhagia is managed by A. Danazol, B. Progesterone, C. Estrogen, and D. Dilatation and curettage. The menorrhagia is the medical term for menstrual period, medical term of menstrual periods with abnormally heavy and prolonged periods. So the first line management includes administration of Brufen NSAID, and we give antifibrinolytic agent. Tranexamic acid also more effective, and in the hormone therapy we give progesterone. If it is not treated, then we go for dilatation and curettage. So option B is the right answer. Question number 7. Which type of hallucination are common in schizophrenia? A. Olfactory, B. Tactile, C. Auditory, D. Visual. Most of the schizophrenia patient will have primary hallucination symptom like auditory hallucination. If any psychiatric patient speaking separately alone, that indicates he is having auditory hallucination. In severe cases, there will be visual hallucination. More severe cases leads to tactile, olfactory, gustatory, etc. Question number 7, answer is C. Question number 8, normal intracranial pressure in adult is A 1 to 7 millimeter of mercury, B 5 to 10 15 millimeter of mercury, C 1 to 15 to 25 millimeter of mercury, D 20 to 30 millimeter of mercury. The right answer option B 5 to 15 millimeter of mercury. Question number 9, which surgical procedure has the highest incidence of ureteric injury? A. Vaginal hysterectomy, B. Wertheim's hysterectomy, C. Abdominal hysterectomy, D. Anterior colpography. So we have seen many reviews of literature to get the latest incidence. In that, obstetric procedure like cesarean hysterectomy have 0.5 to 8.0 percentage of ureteric injury, but gynecological procedure like Wertheim's hysterectomy has the highest incidence rate of 1 to 30 percentage. So option B is right. Question number 10. Which test indicates lung maturity? A. Non-stress test, B. Shake test, C. Klager's test, and D. None of these. We all know very well. Shake test is also called as foam test or bubble test. It is a simple, rapid method for the estimation of lung maturity. Non-stress test is a simple way of checking the baby is healthy or not. Geiger's test is used to determine the extent of damage to the deltoid ligament. So the right answer is option B, shake test. Question number 11. Appropriate indication for Foley catheter includes all except acute urinary retention, B. To obtain urine sample who voids voluntarily, C. Pelvic fracture, and D. Intraoperative monitoring of urinary output. We know very well if the patient is voiding voluntarily, then there is no need of any Foley catheter. So the right answer option B, to obtain urine sample who voids voluntary, whereas other three, acute urinary retention, pelvic fracture, intraoperative monitoring of urinary output, needs Foley catheter. Question number 12. Most common site of cancer in female with high death rate is A. Cervix, B. Uterus, C. Breast, D. Pancreas. So highest death rate in female because of cancer is option C. Breast. Breast cancer is more common. Question number 13. The causative agent of cervical cancer. A. Herpes zoster virus, B. Human papilloma virus, C. Herpes simplex virus, D. Epstein-Barr virus. The right answer you know very well. It is human papilloma virus which is causing the cervical cancer. Question number 14. The most important aspect of aseptic technique is A. Hand washing technique, B. Gowning technique, C. Mask, and D. Gloving technique. The right answer very well you can tell. It is a hand washing technique. It's the primary aseptic technique procedure. The first procedure we used to do in our nursing also hand washing technique. These other procedures are comes next. Question number 15. The most severe side effect in child with meningitis is most severe side effect. So A. Blindness, B. Jaundice, C. Seizure, D. Communicating hydrocephalus. Even hydrocephalus is also one of the side effect of meningitis. The most severe side effect in children with meningitis is option C. Seizure. Blindness and jaundice is not related to meningitis, whereas seizure and communicating hydrocephalus are related, but most severe side effect is seizure. Question number 16. Some medicines are given in the form of capsules. These capsules are made up of A. Lipids, B. Starch, C. Embryonic tissues, and D. Gelatinous materials. Capsules are usually gelatinous nature. So option D, gelatinous material is the right answer. Question number 17. All drugs are used in the management of status epilepticus except A. Thiopentone sodium, B. Diazepam, C. Carbamazepine, D. Phenytoin. The drug of choice for status epilepticus or epilepsy, we can use diazepam, carbamazepine, phenytoin, but thiopentone sodium is a anesthetic agent which we cannot give for patient with status epilepticus. So the right answer is option A, thiopentone sodium. Question number 18. The most useful bedside test to suggest snake bite envenomation is A. Prothrombin time, B. 20-minute whole blood clotting time, C. International normalized ratio, D. Platelet count. So to identify the venom of a client who got envenomation, so envenomation first, it is a process by which the venomous substance is injected by means of bite or sting of some poisonous animal. So here the bedside test which we have to done immediately to find the cause of coagulopathy is 20-minute whole blood clotting time. This is the test commonly we used to perform. If the test is negative, the blood will become coagulated. In the case if the blood is not going to clot, in the specimen bottle, if the blood is going to be a liquid after 20 minutes also in a room temperature, that indicates there is positive. So 20-minute whole blood clotting time test should be done to identify the patient is going to have coagulopathy or to identify the antibody of the snake venom. Question number 19. The cause of hypoglycemia in neonate includes all except A. Prematurity, B. Growth hormone deficiency, C. Hypothermia, D. Perinatal stress. Prematurity definitely cause hypoglycemia. Growth hormone deficiency also cause hypoglycemia. Perinatal stress also leads to hypoglycemia in newborn. Whereas hyperthermia will cause hypoglycemia. Hypothermia will not cause hypoglycemia. So option C is right. Question number 20. Which vitamin listed below will increase HDL and decreases LDL? A. Thiamine, B. Niacin, C. Riboflavin, D. Pantothenic acid. So the right answer, niacin. Niacin has the anti, what we can say, hyperlipidemic property, and niacin has the property to increase the HDL level and decrease the bad cholesterol LDL. So niacin can be used in the treatment of hyperlipidemia. To control your blood cholesterol level, you have to eat food rich in niacin. Question number 21. Dark brown color amniotic fluid indicates A. Intrauterine death, B. Meconium stained, C. Post maturity, D. Accidental hemorrhage. So in case of intrauterine death, dark brown color amniotic fluid we can expect. In meconium stained amniotic fluid means green color. Post maturity, that is greenish yellow color amniotic fluid. If there is dark color amniotic fluid, that indicates it is accidental hemorrhage. So option A, intrauterine death, where dark brown color amniotic fluid is seen. Question number 22. In a pregnancy, a pigmented line runs from the pubis to the umbilicus. Is A. Linea nigra, B. Stria gravidium, C. Colasma, D. Lochia. So linea nigra is a vertical line. Usually it is due to hyperpigmentation, and it is on a trademark of pregnancy which runs from pubis to umbilicus. Sometimes it runs to whole of the abdomen. So answer is linea nigra. Question number 23. Which is not included in the 5 P's of acute compartment syndrome? A. Pain, B. Paralysis, C. Pallor, and D. Pulse pressure widen. So the 5 P's of acute compartment syndrome. First you must know that includes pain, paralysis, pallor, paresthesia, and we have the another one is uh, this one, paralysis. pain, paralysis, pallor, pulse. This one pulselessness. The fifth one is pulselessness. So pulse pressure voidant is not included in that. Pain, paralysis, pallor, pulselessness, and paresthesia. So these are the 5 P's of acute compartment syndrome. Question number 23, answer D is right. Question number 24, image based question. Match the following color of IV cannula and their sizes. So you have different IV color. If your cannula color is A, that is yellow color, B, you have orange color, C, green color, D, pink color, E, blue color. The size of the gauze, 18 gauge, 20 gauge, 14 gauge, 24 gauge, and 20 gauge. How you are going to match it? Let's see the right matching in next slide. So 18 gauge having green color, 22 gauge is blue color, 14 gauge is orange color, 24 gauge is yellow, and 20 gauge is pink. For we use that yellow for neonate. Question number 25. Ringer lactate is an example of A. Hypertonic, B. Isotonic, C. Hypotonic, D. None of this. Hypertonic we can say 5% dextrose, and for 0.45 percentage of sodium chloride is example of hypotonic. Ringer lactate is isotonic. Hope you understood this. So answer is isotonic. Now, 26th question. The cause of pruritus in chronic kidney disease patient is A. Hyperkalemia, B. Hypernatremia, C. Uremia, D. Hyperphosphatemia. In chronic kidney disease, there is accumulation of urea in the blood which causes pruritus, that is persisting itching of the skin. Uremia is the right answer. Question number 27. Which position is used for perineal prostatectomy? A. Lithotomy, B. Left lateral, C. Lateral chest position, D. Sims position. So in perineal prostatectomy we use lithotomy position. Question number 28. What is the other name for thumb forceps? A. Kelly's forceps, B. Mouse teeth, D. Needle holder, D. Mosquito forceps. So thumb forceps is also known as mouse teeth forceps. Question number 29. Alpha keratin is a protein present in A. Wool, B. Blood, C. Eggs, D. Skin. Alpha keratin is a type of protein commonly present in the skin. Question number 30. A neonate requires blood transfusion after birth. Which of the following cannulation site is most preferred? A. Scalp vein, B. Umbilical cord, D. Intraosseous, and D is subclavian. So for transmission of blood in neonate we use umbilical cord. Question number 31. Gynecomastia is occur as a side effect of A. Bromocriptine, B. Cimetidine, D. Famotidine, and D. Levodopa. The right answer, gynecomastia occur as the side effect of cimetidine. Cimetidine mostly cause the increased breast size in males. That is called gynecomastia. Now let's see the 32nd question. Before seeing 32nd question, some of my subscribers have requested me to speak in Hindi and take lectures. For them, I am going to speak some of my Hindi language or how I can speak. I want to show them. नमस्ते, आप लोग मेरे को बहुत प्यार से रिक्वेस्ट दिया था हिंदी से लेक्चर कर लो, लेक्चर पढ़ाओ. मेरा हिंदी इतना अच्छी नहीं है. मेरा हिंदी आप लोग का कैसे समझ करते मेरे को पता नहीं. मेरा मदर टंग तमिल है, इसलिए मैं हिंदी ज़्यादा यूज़ नहीं कर सकते. हिंदी यूज़ करने के लिए मैं बहुत 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 कोशिश करते. अभी इतना स्पीकिंग है, दैट्स ओनली बिकॉज ऑफ मेरा स्टूडेंट्स और मेरे कलीग्स से बात करते फिर मैं थोड़ा थोड़ा हिंदी सीखते हैं. मैं कोशिश करता हूँ हमारा फ्यूचर वीडियोस में ज़्यादा हिंदी यूज़ करने के लिए मैं बहुत कोशिश करूँगे। अभी धीरे-धीरे मैं हिंदी यूज़ करने के लिए थोड़ा अडॉप्ट हो चुकी है, मैं यूज़ करूँगा। इस वीडियो के बाद आप मेरा हिंदी कैसे है, मैं क्या इम्प्रूव करना, कैसे इम्प्रूव करना, हमारा कमेंट बॉक्स नीचे ना आप लिख लो, मैं वो पढ़ के फिर मैं इम्प्रूव करते, तो मेरा फीडबैक ना आप दे दो, फिर मैं फ्यूचर वीडियोस में धीरे धीरे हिंदी इम्प्रूव कर सकते, यूज कर सकते हैं, ठीक है। ओके, लेट्स सी द 32nd क्वेश्चन। A mixture contains paint and water in the ratio 4:3. If 5 liter of water is added to the mixture, the ratio becomes 4:5. Find the quantity of paint in the given mixture. Option A 12 liter, B 10 liter, C 15 liter and D 8 liter. अभी देखना कैसे ये क्वेश्चन सॉल्व करना। Solution, the quantity of paint and water be 4x liter and 3x liter. So according to the question, 4:3. So here 5 liter water is added to the mixture. 5 liter water is added to the mixture. So we can write like that. When we add 5 liter water to the already having 3 liter of water. So now we can write like that. 4x upon 3x plus 5 is equal to 4 divided by this 4 divided by 5 is after adding 5 liter of water, the ratio is changed from 4:3 to 4:5. Here next 4x into 5. So how this 5 comes means from your right side the 5 goes to left side, it becomes multiplication 4x into 5. So this is x and this is multiplication symbol. 4x into 5 is equal to 4 and this 3x plus 5 which is in the left side denominator comes this side, in the right side it becomes multiplication. So now 20x is equal to 12x plus 20. So like this we can write. So 12x 4 into 3 12x 4 into 5 that is 20. So 20x is equal to 12x plus 20, like that we can write. Now this 12x when it goes to the left hand side इसी तरफ जाएगी, it become minus 20x minus 12x is equal to 20. So अभी 8x, now 8x is equal to 20. So x is equal to 20 upon 8. So which gives 5 by 2, that is 2.5. The quality of paint which is 4 into 2.5. So substitute the value of 2.5 in the paint value. So paint is the 4x. So now that becomes the paint quality, the quantity becomes 10 liter. So our answer 10 liter is सही है. अभी next question let's see. Question number 33. If 36 men can do a piece of work in 25 hours, in how many hours will 15 men do it? Option A 36 hours, B 40 hours, C 54 hours, D 60 hours. Let's see the sum. So here 36 men do a piece of work in 25 hours. So you know the basic thing, less man doing the काम, it takes more time. So अगर ज़्यादा लोग काम करते टाइम कम होता है, अगर कम करते कम लोग फिर घंटे ज़्यादा हो जाएगी, आपको पता ना. Now let the required number of hours be x. So we can write like that 15 is to 36. So here 15 hour. If the 15 men, what is the ratio? That ratio between 15 men and 36 men. So we can write like that. So 25 is to x. 25 is the hour. Now we can write like that. So this can be written in this way also. 15 into x is equal to 36 into 25. So x is equal to, keep the x here, 36 into 25, this 15 when comes to right hand side it goes to niche denominator. So x is equal to 60 hours. Hence 15 men can do the work in 60 hours. So the answer is 60 hours. Option D is right. So x is equal to 60 hours. So पहले आपको पता ना, let the required number of hours be x. So we got the x value. X value is 60 hours. Okay. Now let's see the question number 34. Find the HCF of 108, 288 and 360. The options are given 36, 40, 54 and 60. This is one of the basic sum LCM HCF. In this video, let's see how to do HCF. Let's go HCF. Like this, you have to divide the numbers. So take the number individually 108. So 3 divided by 108, that becomes like 36. And this 3 divided by 36 becomes 12. And with the 12 can be divided with 3, that becomes 4. And the 4 can be divided with 2, that is 2. So now this 108 I can be writing like this. May I say be लिख सकता 3 into 3 into 3 into 2 into 2. I say 228 may divide करते, like first I divide with the 2 because it is even number. Then 288 divided by 2 becomes 144. 144 is divisible with 3, it becomes 48. And this 48 when divided with 2 it becomes 24. 24 again divided by 2 becomes 12. 12 when divided with 2 becomes 6. 6 divided by 2 becomes 3. So I can also write like that. So order only I am changing and writing so that all the things are looking similar. So first I am writing how many 3's are there. So here there are 2 3's. So I am writing like 3 into 3 into Baki Sara 2 hai. All others are 2. I can also write like this so that it will be easy for us to see which numbers are common here. 360 also we are dividing like that with 3, 120, and 120 divided by 3 becomes 40, 40 divided by 2 becomes 20, 20 divided by 2 becomes 10, and 10 divided by 2 becomes 5. So ऐसे में लिखते हैं, फिर मैं I am taking all the common numbers in both. So here 3 3's are there, but in the next we have only 2 3's in either be only 2 3's. So I omit the third 3. So I'm taking all the 3's. So 2 3's and 2 2's, which is very common here. Even though we have 5 2's, but we are taking only 2 because in the first one only 2 2's are there. So we have taken the common numbers. So when we multiply that 3 into 3 9, 9 into 2 18, 18 into 36. So 36 is the answer. Now question number 35. An unbiased die is tossed. Find the probability of getting a multiple of 3. So A 2 by 3, B 3 by 3, C 1 by 3 and D 4 by 3. So this is sum based on probability. So here when you throw a die, we can get the things like it can come 1, 2, 3, 4, 5, 6 like that. We can able to get any number. So 6 sides are there in a die, we can get any one number 1, 2, 3, 4, 5, 6. So what is the expected event like of getting a multiple of 3? So expected event of getting multiple of 3. So in this 3 is a multiple of 3 and 6 is a multiple of 3. So this is expected event. So then the probability expected is equal to n by e by n by s. N by s we have 6 options and n by e there are 2 options. 2 by 6 is 1 by 3. So option C is 1 by 3 is the right answer. Hope आपको समझ कर सकते. Let's see question number 36. Odd man out. Find the odd man out. So series of number is given 3, 5, 7, 12, 17, 19. And which is the odd man out? Option A 3, B 7, C 12, D 19. So all numbers are not divisible by, all numbers are prime. Only this 12 is a number which can be divisible by any other number. So the odd man out here is 12. Question number 37. Some of general science question. Choose the word which is least like the other word in a group. So in this group of various mineral, which one is totally different? It is also like odd man out. A zinc, B aluminium, C mercury and D copper. So here mercury is in liquid form whereas others zinc, aluminium, copper is in the solid form में होता है. So mercury is the answer. Question number 38. Find the next term in this series. Panch, now, Satra, 29, 45 and what number will replace here. So you can see that 5 plus 4 9 and 9 4 4. Now we are adding 8, so that will give 17, and again you are adding 8, 17 plus 19. Uh, sorry, from the 8 you are adding 4, that will be 17 plus 12 29. From 29 you are adding already you are having 12, 12 plus 4, that's 16, 45, and if you add 20, that will become, the answer will be 65. Now let's see the 39th question. How many combination of two digit number having 8 can be made from the following number? The Now you have the numbers like 852176. So what is the question? How many combination of two digit number having 8 can be made from the following number? So you can write. So if you make the two digit 88, 85, 82, 81, 87, 86, and you can also make like 58, 28, 18, 17, 16. So when you make like that, how many number with 8 you can have? So write and see, and you will get, there are chance of getting 11 numbers. So here how many numbers you are having? Totally you are having 6 number. So 8 combines with all other 5. So we get 58, 28, so that we will get 5 numbers. So if you put 8 before, 85, 82, 81, 87, so again you will get 5. So 5 plus 5, 10, and 88 can be written as a separate two digit number, so that 11 number you can get in this combination with 8. Question number 40. Introducing a man. This question is related to relationship question. Introducing a man, a woman said, his wife is the only daughter of my father. A woman is saying by noting a man, uh, his wife is the only daughter of my father. So इनकी पापा का एक ही लड़की है. सो रिलेशन, वो मैन की, वो आदमी की, वो लड़की क्या रिलेशन है? ऑप्शन ए फादर, बी ब्रदर, सी हस्बैंड, डी अंकल. So the right relation will be husband. The man will be a husband of this girl. Question number 41. Raman ranks 16th from the top and 49th from the bottom in a class. How many students are there in the class? Very simple. 16th rank from the top, and from Nietzsche, his rank is 49th. So 16. So ऊपर 16 को ऊपर 15 स्टूडेंट है, and here 40, we are 15 ऊपर है, and here from the class his rank from the bottom how much? 49. So 48. 48 plus this one, that will be 64. So this is the right answer. So from Nietzsche you are counting, that will be 48, and his rank from the top is 15. So that will come 64. Question number 42. Which among the following is called gift of the Nile? So these questions are related to general knowledge and general science. So gift of Nile is option C, Egypt. Question number 43. Who is known as the artist of the world famous painting Mona Lisa? You have a Filippo Brunelleschi, you have Michelangelo, Vincent van Gogh, and Leonardo da Vinci. The right answer is Leonardo da Vinci. Leonardo da Vinci is the famous artist who drawn Mona Lisa. Question number 44. Which among the following was the first municipal corporation set up in India in the year 1687? So in the year 1687, in India there was municipal corporation. Which one is that? A. Madras Municipal Corporation, B. Bombay Municipal Corporation, C. Delhi Municipal Corporation, and D. Calcutta Municipal Corporation. The right answer is Madras Municipal Corporation comes first, then Bombay, after that Delhi. Question number 45. In which year first census was conducted in India? So first census, we know census is conducted every 10 years once. The first census in India was conducted A 1884, B 1872, C 1881, D 1856. The right answer is option B 1872. पहले census India में conduct किया था. Question number 46. Shivaji, this is subscriber question. ये क्वेश्चन का आंसर आप नीचे कमेंट कर सकता, so that indicate that this is a motivation for our subscriber to tell their answer by themselves. Shivaji had formed a council of 8 ministers that administered the Maratha Empire. The municipal was named as A. Naya Pradhan, B. Ashtasena, C. Ashtasiddhi, and D. Ashtapradhan. Marathi people can easily give the answer here. The question based on the great emperor Shivaji. So, आपकी answer please write in the comment box here. Hope your answer will be correct. Question number 47. Which gases causes acid rain? A. Sulfur dioxide, B. Copper dioxide, C. Nitrogen dioxide, and D. Both A and C. So the gas causing acid rain is A. Sulfur dioxide. 48. Which is called white poison? A. Ghee, B. Sugar, C. Salt, D. Calcium. The white poison is option B. Sugar. Question number 49. Accumulation of which chemical leads to kidney disease? A. Calcium carbonate, B. Calcium oxalate, C. Calcium oxide, D. Calcium nitrate. Accumulation of which chemical leads to kidney disease? The right answer is calcium oxalate. Question number 50. The power to determine the number of judges in a high court lies with A. Governor, B. President of India, C. Prime Minister, D. Chief Minister. So, who is having the power to decide how many judges are to be appointed in the high court? The power is in the hand of President of India. Thank you for watching this video. Hope you enjoyed these 50 questions. If you have any doubt, please comment in the comment box. भूल मत करना, मेरा हिंदी कैसे है आप बिल्कुल आप मेरे को फीडबैक देना, ठीक है। नेक्स्ट वीडियो वी विल सी अनदर गुड क्वेश्चन। थैंक यू ऑल, बाय बाय।